So welcome everyone, if you're here in person or if you're watching a recording. My name is Jason Prystowsky. I am the Academic Coordinator for the Medical Humanities program at UCSB. And this is the Medical Humanities Summer Seminar Conversations with Clinicians. And for those of you who are new to this, the Medical Humanities is a new program. We just completed our first year. And the goal of the Medical Humanities is to mostly to students who are interested in careers in healthcare, give them a foundation and an exposure to the humanities as it applies to clinical medicine and public health. So we talk about history of medicine, medical ethics, medicine as portrayed in different cultures, medicine in narrative and in film. And this is a continuation of that, where we're going to talk a little bit about character today. So just to kind of, this is a new, we're using the Zoom webinar format for the first time. So I apologize if there are any snafus. Please use either the chat box or the question answer box for the students who are in the room. Before I introduce our panelists and jump right into the conversation, the humanities is the study of that which has to do with the human condition. And we learn about the human condition through art, through music, through literature, through philosophy, through a variety of lenses and contexts. And we've used the humanities to really discuss clinical medicine, public health, in the Medical Humanities program. And then this huge iceberg, this huge historical event happened on our watch, which is the 2020 pandemic of COVID-19. And I thought that as we discuss the humanities and as we've discussed character within the humanities, we can continue this conversation and really draw in from the wealth of our clinicians locally in talking about the humanities and talking about this huge event that's impacted all of us. And I think, in the spring quarter of the Medical Humanities program, and for students who are interested in the Medical Humanities program, it is a certificate program at UCSB, and you can certainly check that out at either the PACE Extensions website or the Division of the Humanities and Fine Arts website for UCSB. In spring quarter, we talked a little bit about character. And that's what we're going to be talking about now. And we're going to be talking about it within the context of COVID-19. And character, and we have, I'm sure Kayla is going to give us some more context in this as a psychiatrist. Something changed in the history of how we look at values from a virtue-based approach to a more procedure-based approach. And a lot of historians have talked about this shift, where in the 19th century, sorry, my babysitter is texting me. This is Education, the Age of Zoom. In the 19th century, there are a lot of discussions about characters and the inherent qualities about who we are, and a virtue-based ethics approach. And then something changed in the 20th century and has really taken off in the 21st century in the era of social media, of thinking about things as more procedural. How does the world perceive me? And a lot of students interested in careers in medicine have a scripted approach where, if I follow this script, if I do A, B, C, D, E, I will be a good doctor. I will be happy. I will have fulfillment. And, if I get good grades, if I ace the MChat, if I get this much research experience, if I get this many volunteer hours, then I'm going to be a great physician. I'm going to be a great mental health provider. I'm going to be a great nurse. And it's kind of we've talked about this in the Medical Humanities program, a bit of a flawed way of thinking. And I like to use David Brooks's model, although we're going to talk about this a little bit more in the conversation, where David Brooks in his book, The Road to Character, talks about resume values and eulogy values. Resume values being that which we spend a lot of time developing, we got good grades, we did well on the MCAT, we're CPR certified, went to this medical school and got this rank in this medical school. These are resume values, and we spend a lot of time, but yet when we die, our eulogy oftentimes talks about a different narrative and a different set of values. Courage, integrity, honesty, commitment, compassion, ethics, justice. These are the values that really speak to the soul. And that's what we're going to be talking about now in this very informal kind of conversational aspect. I like to pretend that we're in Charlie's backyard right now, sipping whiskey, having these huge conversations about how the COVID-19 pandemic has really, whether or not did it change the dialogue of values, or did it just turn the lights on and expose values? Where, I quote a lot of philosophers, I quote a lot of Plato and Aristotle, but this time I'm going to quote the philosopher Fred Rogers of Mr. Rogers' Neighborhood, when he said, when there's a crisis, when there's a fire, always look for the helpers, look for the people who lean into crisis. And the discussion has really, there's been a lot of discussion about that with clinicians in the COVID-19 pandemic. So with that, I'm going to moderate. Please put your questions in the question box or the chat box. I'm going to introduce my three good friends. Conversation with clinicians in a lot of ways is an excuse for me to get my good friends together to talk about meaningful topics. We have Dr. Charlie Stoller, who is a pediatric surgeon who spent a big part of his career at this small liberal arts school in New York. It's a good school. I like to say it's the UCSB of New York, as the chair of surgery at Columbia University. And you've made a whole career out of training surgeons before you came to our little beachside community here in Santa Barbara. And I'm really excited to hear, because you originally started your career off as a musician and went to medical school because of the Vietnam War. And then I want to introduce also Dr. Jerry Hoffman, who has been a mentor of mine for many years. Before I even met him, I attended his lectures and read his papers. A very distinguished professor and researcher in emergency medicine who spent a great part of his career in UCLA. And I think you'd be hard-pressed to find an emergency physician in the United States that doesn't have some kind of fingerprint of Jerry Hoffman on them. And we're really lucky to have him in our Santa Barbara community. And you got your start in theater. So everyone here has like some kind of background in humanities before going into medicine. And then to balance the testosterone in the room, we have my great friend, Dr. Kayla Rosen, who is a psychiatrist who is at UCSB Student Health, has a really diverse background in literature. I'm really proud you're on the board of directors for Doctors Without Walls. You're kind of a superhero in my book. And you're also a really talented educator. And as we talk about character, it's going to be great to get the insight of a mental health professional to think about the existential insight into values and what kind of values we really should be cultivating in medicine. So at that, I want to just open the forum, and I can kind of maybe start by asking a question, which is, this pandemic has really pulled back the veil and exposed the character of a lot of people in medicine. And I'm interested to hear your insight and your thoughts about it. I don't know who wants to take the first, to be the first person to start the conversation. You got to unmute yourself, Charlie.
I'll offer the following, that these issues that have been unmasked have always been there, but now the lights are on and the Band-Aids are off. I can just talk about my own political evolution. Prior to all this, I was ambivalent about Medicare for all and all that stuff, and now I'm all in because I've seen how unbelievably bad, unfixable the current system is. It's exposed major flaws in the bright daylight, and it's not just in healthcare. It tracks to income inequality and all sorts of class discrimination, and the wounds that are being exposed are massive. And the crime will be is if we waste the crisis. That's going to be the crime. I don't know whose line that was. It's a shame to waste a good crisis. Somebody said that. Maybe you know Jerry, Kayla. I don't know. But that's the point. If this is an opportunity, this is not, yes, this is horrible and awful and bad and all sorts of negative stuff, but it's an amazing opportunity to make quality improvements, real structural improvements at so many levels. So I think that's what's happened for me.
That quote was from Winston Churchill or Mark Twain, or perhaps it was, it's always one of those, right? Maybe
well,
it was William Oster, I think.
The famous quote from Mark Twain is that the lies are the things you tell your children to keep from going insane.
Yeah, so Kaylee, you want to speak up, or?
Sure. So when I hear about the word character, I thought I would start with this. One of the things that comes to mind is, like, of course, the individual. We often think of character as qualities that one cultivates inside oneself as an individual. And I think in America, I would just highlight that I think we have a very individualist perspective often. If you look at the history of American culture, it's very individually focused. But what I would suggest is that character is not just about something that one cultivates as an individual, but there's very much of an interplay with one's community, and the community that you choose to surround yourself in or with, or the community that you find yourself in. And one thing that I have thought about a lot in the pandemic is I think that one's character can either be enhanced or potentially degraded, depending on the surrounding community, and also depending on the role models and the leadership that one is subjected to. So that's something that I've observed a lot, that if there's good leadership, and if there's community that espouses certain values, and that more than that actually create a platform for people, that brings out people's strengths, that becomes an environment for people to really demonstrate wonderful character. And then unfortunately, the opposite is true as well. I think that with certain types of leadership and certain types of communities, poor character can emerge from it. So I think that the interplay between a person and between the community it's all a part of an ecosystem.
And I have so many questions that I want to put on the shelf about that, because the whole idea of how do you cultivate your character and how do you cultivate your community and your tribe is such an important part in the journey of becoming a healer. But I want to hear what Jerry has to say as well.
But what both of you said resonates with me. Charlie talked about the massive problems that we have as a society that have been exposed. I think they were pretty well exposed long before this pandemic, but there's certainly been had a spotlight shined on them, and I think your comments are well taken. But I'm really glad that you talked about community, Kayla, because I was going to talk about it, but from a slightly different point of view. What you said, I think, is really true, which is that there are always people who tend to go in one extreme in one direction, have a point of view, and there are others at the other, but there's usually a large middle that gets tremendously influenced by what happens around us. And so the culture of a community is tremendously important. You mentioned that America is at the extreme of an individualistic society. And I lived in Japan for a while, which is sort of at the extreme of a communal society. And I've always, before I went to Japan, I always thought that I was a dyed-in-the-wool communitarian. And I realized over there that carrying it to an extreme has real problems. And there is important for us to maintain some sense of being individual people, not just part of a group. But that being said, we are so far in the other direction that I think it causes lots of problems. And I think what we're seeing today has exposed the extent to which the United States is a tremendously selfish, individualistic society for the most part. Now, that being said, we're not uniform. It's not a monolith, and so it's clear. Just as when in times of crisis, you always see the ability of human beings to evince the most incredibly positive, generous behaviors, selfless, courageous behaviors that you see in war, in the Holocaust, in fascism. You get to see people behave in a way that you hope that you could behave if you were in that circumstance. And you also see the exact opposite. You see people behave in the most cruel and vicious ways. And sometimes, bizarrely, it's the same people who are capable of both extremes. That's not to say that everybody's the same and everybody would act the same under circumstances, which I've heard some people sometimes suggest. I don't think that's true at all. But probably all of us are capable of a range of behavior. And in a crisis, that tends to come out. In any case, today, I think we're seeing, you talked about what COVID is doing, but I think this moment is more than COVID. This moment is a special, seems to me to be a very particular moment in history, not just because of COVID, but because of the massive protests we're seeing regarding our 300-year, 500-year struggle with racism and our inability to deal with it and police brutality. And so we have a sort of a perfect storm of events that has made it clear what's going on in our society. And we see these different threads, and the responses are extremely different. They range from, I don't have to wear a mask if I don't want to we need to take care of each other. We need to have a universal health care system so we can take care of each other. Anyway, I think there's a lot that's going on, and it's much more than just COVID. And I'll just remind people that I think we in America now feel extremely fragile because of all that's going on. We can't go to the supermarket, for example. But if you think about the rest of the world, we're fairly unique in that we haven't really had war on our own soil for a long time. And in much of the world, crises like these, like what we're having today, I can't leave my house, has been very common for long periods during war, during civil unrest, etc. So we've been very privileged, but what we're experiencing is something that humanity has had to deal with for a long time. Anyway, I've spoken enough.
Yeah, no, I want to hear Charlie's responses, but also it's an interesting comment when we talk about crisis, because when we look at literature, we look at narrative, we look at film. A lot of times heroes require crisis, right? Crisis puts a stress and it really allows certain character virtues to shine. And what's interesting about the COVID-19 pandemic is that a lot of these systemic inequalities that have existed since the birth of our nation were there. And now COVID-19 has really brought a lot of it, it's boiled it and brought a lot of it to the surface. And I think one of the questions that's going to continue to be on my mind, especially for the students, is as we think about what crisis can do and what crisis can polarize people to do, how can students begin to develop the foundation of character virtues that will allow them to flourish when the next crisis comes and allow them to be part of the solution when the next crisis comes? But I want to hear Charlie's response. So,
I had two comments. I want to build on what both Kayla and Jerry were saying. This idea of the United States being a very individualistic country, that's our foundational document. This country is founded by Calvinists, Cotton Mather and all those folks. This is all, you're responsible for your own outcome, pick yourself up by your own bootstraps. You're responsible for yourself. Nobody else is going to take care of you. You are what you eat. And that's sort of a foundational concept to this country. And the reason I'm bringing it up, because I'm going to guess in the 96 folks that have signed up for this webinar, there's not a lot of Calvinists out there. And I bet there's a range of ethnic backgrounds that may not share that that foundational concept. And I'm wondering what this individualistic society looks like to somebody for whom that may not be the operating norm, number one. The other thing is related to your comment, Kayla, about community. As Jerry alleged, Jason said, I come from Columbia, the commuter college in New York City. And
the UCSB of New York City, yeah.
Exactly, yeah, Gauchos of New York, yeah, Lonesome Cowboy. That's what they did, Lonesome Cowboy. But I was talking to my friends who were very deeply involved in the COVID crisis there 3-4 months ago when it was at its very apex, or nadir, however you want to look at it. And the comment was, they had people working outside their lanes. They had adult patients in the pediatric ICU. They had pediatric surgeons taking care of adult medical patients. They had people doing way outside their lane. And the augmentation of community was intense. All of a sudden, instead of, the surgeons are here, the pediatricians are there, the anesthesia is there, and the ER docs are over there, it totally enhanced the sense of medical community. It was very touching. And you may remember the story about the ER doc that committed suicide. That was a huge outpouring when that happened. That was not in a vacuum. And it exposed the sense of community. If anything good, one of the good things, if you will, that's come from this COVID stuff is the sense of enhanced medical community. And one of the problems with medical education today is we're all siloed into this specialty and that specialty, and we don't talk to anybody outside our specialty. But this epidemic, this pandemic, is breaking down those silos. And anything we can do to enhance that and enhance the sense of medical community, because at the end of the day, we're all in this together. Our goal is to relieve human suffering, however you do it. We're all in this together. We're not in vacuums. We're not in silos. And so, as I said, if anything good comes out of this COVID business, it's this sense of enhanced medical community, because it creates a commonality of purpose.
It's interesting because I want to take
that. Charlie, you mentioned that not everybody's a Calvinist. Well, in fact, yes, it's true that the Calvinists had an influence on their community 300 years ago. But the fact that America, which has come from all over the world and represents a vast set of immigrants with all different communities, but yet that particular thread has become so general and so dominant in our society, I don't think we can really blame it on the Calvinists. I think what it reflects is what Kayla was talking about, which is that there are dominant themes in our culture that get spread to everybody. So you may come here from somewhere else where the ethos was very, very, very different. But when you get here, we're bombarded every day with messages about how you have to stand up for yourself, how you have to do it yourself, how success is defined as those things. This is, if we want to change that, it has nothing to do with Calvinists. We have to change the public, the discourse about what it is to be a society.
Let me ask a question, Jerry. Let me convert this into a question, because I think that this is a huge theme of the American culture of radical individualism, and the shared village mindset. And I think, from a public health standpoint, the data, and this, what's interesting is we're talking about values and character while we still have our clinical and public health minds. And when you look at the public health data, that the cultures that are radically individualistic and value autonomy above all else are doing very poorly. And the cultures that have a community priority, the village comes first. We're gonna figure out how to combat this together, and I have a duty to protect. I'm gonna wear a mask because it's my responsibility to wear a mask to protect my neighbor. Like when I was on the Navajo reservation a few weeks ago, you protect your elders by wearing a mask. And the countries and the cultures that have that theme tend to do better.
Of course.
And the way to turn this into a question is given the idea of empathy as a virtue, and the idea of compassion, and the idea of altruism, how do we change the culture, and how do students begin to develop skill sets so that they can influence their community? You know, this goes to the age-old philosophical question, can virtue be taught, right? You know, given the fact that a lot of our students are the future leaders of healthcare, you know, these community organizing skill sets are not necessarily taught in medical school. And how can students begin to recognize some of the skills that they need to develop and the character that they need to develop to begin to become leaders in their communities for when the next crisis comes?
I personally don't think you can teach virtue, but I think
I agree.
We're each complex individuals, and we each have many different characteristics. And what you can do is help people. We can help ourselves, and we can help others. Remind us of our best selves, and help us to emphasize those behaviors that we would like to act like, rather than the ones that are most selfish. I've spent a lot of time as a teacher, and one of the things I think is most effective in trying to change behaviors is not to scold people for when they're doing bad things, but to remind them of their best selves, to remind them of the things that the values that they wanted to express in their career. Most people who go to medical school don't go because they want to make a lot of money. They don't go because they want to get a lot of prestige and they want people to kowtow to them. But unfortunately, after getting brutalized during medical education for a whole bunch of years, a lot of them end up sort of looking a lot like that in their daily life, where they want the money and I deserve it, look how hard it was, et cetera, et cetera. If you tell them you're bad, I don't think anything changes. Yeah, but I went through all this crap, I worked so hard as a resident, et cetera. If on the other hand, you remind them of who they were when they applied to medical school, their best self, what their values were, what they were trying to achieve, that's real. They really did want to be that best self. And I think we can remind ourselves, not just others, of what's important, what's really important. Sometimes in a crisis, you get pulled in both directions. The question is which direction you're going to go. Not that you're going to change yourself, but which part of you is going to respond. And I think we do have some ability to influence that.
Jerry, do you think the COVID-19 pandemic is bringing out peak clinicians' best selves?
I think to some extent, yes, although I have a lot of trouble with this notion of heroes. There's nothing heroic about this. This is what people signed up for when you go to medical school. I remember when AIDS first came around and nobody had any idea how you got it, and it was a terrible, terrible, terrible disease. And then even after we knew and you could get it from a needle stick, I don't know anybody who said, no, I'm not going to take that person's blood, or I'm not going to go near that person, etc. Because this is something that you signed up for. And, you know, I do think there probably are some people who are really selfish, but for the most part, that's not part of why you do this. And, you know, firemen take risks all the time and other people take risks. I don't think we should, this is not heroic. It's certainly honorable. And I do think physicians have acted very honorably, not just physicians, healthcare workers, but I don't want to call them heroes for acting honorably. This is a moment where you can bring out the worst and the best of people. And to the extent that people are doing what's good, we should honor them for that, but not pretend that makes them special.
I know Charlie has a comment that he wants to make too. So
yeah, Jerry, I'm so down with exactly what you're saying. I hate this heroes bullshit. This is your job. This is what you signed up for. You know, you're expected. The operating norm is to run to the fire. That's normal. Running away from the fire, that's not normal. So this is what you signed up for. So I hate this heroes bullshit. I can't stand it.
Well,
you know, honorable is one thing, and that's an important word, and that's different. You know, honoring your commitment is something to be noted. But being awarded, medals as a hero, that's ridiculous.
My good friends at NYU, who, by the way, were in New York with all of them in New York, were at the heart of this and really overwhelmed, and they say they never felt heroic during a shift. They felt overwhelmed and saddened because they're for many reasons that you can imagine. But they never felt like this is something special.
But Jerry, I think that what you're talking about is is humility. And I'm really interested to hear Kayla's discussion, because, you know, so much of being a physician is built on the identity of being a healer. And, you know, and like you said, Jerry, like a lot of people go to medical school, nursing school, paramedics, firefighters, law enforcement, they have these very honorable intentions. And a part of being a healer has this identity that has these sort of values mixed in with it. And I'm really interested in how this pandemic is showing, you know, the 50 something students who are listening in on this panel discussion, who are interested to being physicians or being leaders in healthcare and public health. And they're watching this thinking, you know, what are these values that I need, that, you know, because going into medicine during a pandemic is very different than going into medicine during peacetime. And I'm interested in the whole identity of what it means to be a physician, and how this is all playing out during the time of COVID.
So I want to respond to that, and also to the question that you brought up before about like what could we do, or what could we do for future healers to try to cultivate some of these character traits that we think are virtuous. And I was reflecting a little bit about something, even though I would be the first to say that psychiatry has a lot of flaws, I think psychiatry does one thing very, very well. And I think one of the things that we did very well in my training was spend a lot of time on cultivating our own self-awareness. And one of the impressions that I have, I think most people who enter into healing fields are doing so because they really have a very pure desire to be healers. And however, over time, there can be an erosion of some of these initial virtuous goals or virtuous feelings. So in thinking about like what can prevent this type of erosion, for me, during my training in psychiatry, we really frequently were challenged to enhance and develop our own self-awareness. And we were encouraged to do that individually, whether that was just through analysis of ourselves informally, or even through, we were encouraged also to be in like psychotherapy to analyze it ourselves through that front. But also we had spaces for our cohort to meet together where a very open and very non-shaming atmosphere was created to really examine our own behaviors and our own responses to things. And this was a really vital part of my training. And as an example, we would sit together as a cohort and really think about how did we respond to a particular patient? What were our struggles? What did we do that we felt ashamed of? What did we do when we felt really tired and we did something that was, maybe we said something terrible, or maybe we behaved in a way that was really lacking in character. And there was an environment created where that type of discussion was not only encouraged, it was almost mandated. And the reason for that was actually directly for patient care. Psychiatry, like many fields, of course, it's a very intense emotional field. You're talking constantly with people about topics such as like suicide, people who can't distinguish reality, very, very intense things. A lot of trauma, a lot of discussion surrounding trauma. And one of the ways that we found is vital for being able to really treat our patients well was to do this, because without this, you end up doing what we call in psychiatry enactments, where you don't realize that maybe something from your own life or something from because you were tired or whatever it is coming in and actually influencing the way that you behave with a patient. And maybe that's what is leading to an erosion in terms of your behavior and your desire to be virtuous. So that to me is really important. And so if I had to describe something that I would say is a way to cultivate character, but not only to cultivate it, but actually to preserve it, it would be to create these types of spaces. And it's something that I've wondered about with the pandemic. I've been doing all remote psychiatry, so I'm very, very far away from being in the thick of it in the hospital. But I'm curious about whether there are space is created. I know people are very overwhelmed and there's little time. But for people to say things like, I felt totally hopeless in this situation. What does it feel like when you're in an ER and you have one nurse who's supposed to take care of 10 critically ill patients, and you feel totally hopeless because there's no treatment? Being able to describe hopelessness and being able to describe feeling like what that does to you could be a way to treat your patients better, but also to not burn out.
How do you know the so much of the discussion goes back and forth between the individual and looking into the self and our relationship with our community and our village and our tribe, and this pandemic has affected at least the physical connectedness that we have with people. And a lot of times this kind of space that you're talking about, it happens in, at people's houses, at potlucks, at pubs and bars, in churches, synagogues, and mosques, in yoga studios. Like, the idea of coming together and grieving together and sharing an experience together is such an important part of the human condition that during this pandemic, we're being asked not to do that for the sake of other people's health.
Yes, so that's really, really important. One of the most important things I think I ever did as a physician had nothing to do with medicine, had nothing to do with what I studied in school. It had to do with human contact, with being there for a patient, making eye-to-eye contact, hugging a patient if appropriate, letting them know that I heard what they were worried about. I worked in a very high acuity emergency room, and yet most of my patients were fine, would have been fine if they never came to the emergency room. They were there because they were scared. And so while I was usually able to figure out that there was nothing terribly dangerous going on, they didn't know that. And so one of my most important jobs was to be there for them and to acknowledge what they were feeling, and then to provide them with, bind their anxiety, to let them see that they were okay. And I think that's one of that is a big problem right now with trying to be a healer, when you not only can't touch patients, but you're covered up so that they can't even see you. So I think that is really important. But I would say that everything you're talking about really isn't about COVID. This is all about stuff that's been going on for a long time. There is a long-standing culture in medicine to pretend that you have everything under control and you know what you're doing. And so when you're a medical student and you have no idea what you're doing, you look at your colleagues and they're all pretending that they know what they're doing. So you can't admit that you don't. So you pretend the same thing. They look at you and they say, oh my God, I'm the only one. And this goes on not just in medical school, it goes on in residency and goes on as attendings, et cetera. This is a culture that I've been working to change for a long, long, long time. And so this inability to say, I was scared, inability to say, I don't know if I'm competent, inability to say, I don't know if I can take care of this patient, is something that we have to get rid of in medicine if we want to express our human values. And in the same way, just one last thing, you talked about being able to talk about experiences. One of the things we started to do many years ago, and it's really, real important, is that when you have tragedy in front of you, and in the ER you have tragedy in front of you a fair amount of the time, a little child drowns, somebody gets shot, there's somebody who has a head injury and they're paralyzed or has a stroke, etc. One of the important things that you need to make time for, even in the busiest ER, is for people to get together when something bad has happened and process it and talk to each other and say, I feel really bad. And it's tremendously helpful to be able to not just be strong, but to allow yourself to show that you're weak, that you're fragile. That's how you rebuild your strength. And so there are these cultures in medicine that maybe COVID is exposing to some extent, but go way before COVID. All the things you're talking about being able to be a human community as a healthcare community, just as much as we need to be in the larger community.
And that brings up a very, very interesting question. And maybe this is for Charlie, because in the spectrum of being more in tune with the human condition and our feelings to being more bravado, surgeons, painting a very big general swath, tend to be a little bit more on one side of the spectrum than the other.
Don't go there. Don't go there.
Now, surgeons
Don't make me come down there.
They're shy, retiring folks, surgeons.
But like Charlie initially said, don't let a good crisis go wasted. And one thing COVID has done is everyone in medicine feels helpless. This is a new disease that is highly contagious, that is lethal in certain subsets of the population. And the best tools we have are not excellent. They're not very good. When you look at remdesivir compared to placebo and the mortality, you look at dexamethasone, you look at proning ventilated patients, and there's a shared collective sort of helplessness that we all feel. And can we use this as a platform to say this existed all along? It's just right now we're all feeling it at the same time in a very visible way. And how do we begin to use this as an opportunity to change our culture, to start talking about some of these bigger issues? And I see for the students who are listening, I see the questions are starting to, I'm going to go through all the questions and start divvying them to our panelists soon. But I'm really interested to hear our panelists kind of answer.
So I have to respond now because you're bad-mouthing surgeons. A couple things. One of the problems with, first, I don't particularly like surgeons either. I have no surgical friends, in fact, and they don't like me either, but it's okay. But surgery is a discipline that requires that you make decisions, that you have some degree of certainty, because you're going to open a human body. So it requires some certainty that you make decisions. And one of the challenges is being comfortable being uncertain. And I've always said one of the hallmarks of the mature physician is being comfortable saying, I don't know, I'm not sure. And this, of course, this can devolve into a philosophical discussion about what's truth and what's absolute truth, because at the end of the day, there really isn't any absolute truth. Everything's relative. And so I said, being comfortable in your own skin saying, I don't know, to me is a hallmark of a mature physician of any stripe, surgeon or not. One of the things that I do when I interview surgery residency applicants and pediatric surgery applicants, I ask them, when you come to the interview, I want you to bring the letter you wrote when you applied to medical school about why you wanted to be a doctor. I tell them that's the instruction. Come to the interview, assuming you still have that, and then we're going to talk about what you are now and what you thought you would be. Because one of the big holes in postgraduate education, certainly in medical school too, for that matter, is what Kayla was talking about. Namely, there's no time to understand who you are. There's no time to reflect. It's frowned upon. You've got to learn biochemistry and molecular biology and bacteriology and anatomy and on and on and on. And you got to make all these rounds and all these details in patients. There's no space. There's no space to reflect on who you are and to get yourself grounded. And it's always brought home to me. We've had, once in a while you have some terrible crisis. About a year ago, we had a mother die during childbirth, and we led a lot of sort of debriefing, for lack of a better word, but various people got together to talk about that. And it was, as tragic as it was refreshing to hear people try to ground themselves around this tragic incident. That's an anecdote these days. It doesn't happen regularly, and it's not necessarily something that's applauded either. And that's unfortunate, because the more grounded you are, the more you're going to be able to be a humanist, the more you're going to be able to have the human touch to relate to your patients, not their disease.
So
does that make sense?
Kayla said that they did that actively as part, not debriefing necessarily, but trying to be self-aware. And I was talking about exactly that, debriefing. I think these are tremendously important, and they're important. You said there isn't time for it. There should be time for it.
My point exactly.
In Kayla's residency. So, we need to change the culture so that it reflects that much more broadly. And just one other comment about uncertainty. I believe also that being comfortable with uncertainty is one of the most important skills that a physician must have. Tremendously important. But let's not get confused to think that just because you're uncertain, you're paralyzed. In fact, we almost always have to act in the face of at least some uncertainty, because there's almost never something which is 100% sure. You still have to make your best guess, and you have to be comfortable with the fact that you're not certain and that you could be wrong. And being wrong doesn't mean you did the wrong thing. You may have done exactly the best possible thing, and it turned out you were wrong, because sometimes it isn't that way. But uncertainty is really, really important, but it doesn't, I'm not trying to say you should be arrogant and say, I don't care that I don't know. But on the other hand, if you let yourself be paralyzed, you're not going to be of much use to anybody.
But I'll tell you something.
Here's a concept that,
Hang on 1 second, Charlie. I just a real quick, response to Jerry, because it came up in our spring class for medical humanities surrounding uncertainty. And, I'm an emergency physician and one of your Padawans. And in emergency medicine, you learn to embrace uncertainty. You learn to find joy in uncertainty. When the paramedic phone rings and you have no idea what's going to come in next, you get a little excitement. I wonder what it's going to be, because and it's part of that is because of character. And it's not just an individual character, but it's a shared, collective, communal character that I have worked very hard. I've studied very hard. I'm self-aware. I know what my weaknesses are and I know what my strengths are. And I'm surrounded by a team that I've worked with for months to years, and we're all professionals. And whatever comes through that door next, we're going to, to steal a line from Hemingway, we're going to have courage. We're going to have grace under pressure. We may not know what the answer is, but the process by which we get to that answer is going to be with humility, and it's going to be with best practice and with ethics and with justice and with empathy. And these are character values. And uncertainty is only dangerous when it's untethered and not linked to some of these character values. I want to hear Charlie's response, and then I want to start getting to some of the students' questions.
What am I responding to?
I don't know. I cut you off and interrupted you, and and I always have to give you the last word.
I'm actually looking at one of the student questions about if you're a medical school applicant and you're actually a patient getting mental health care, should you describe that to whoever's interviewing or not? The answer is it's none of their damn business. This is a healthcare issue. This is your personal business. Nobody's damn business. But whether you take aspirin or whether you're on psychotropic agents, it's nobody's damn business. So that issue should not even come up.
That's for sure. But on the other hand, once you're a medical student and you're not worried about how somebody's going to respond, it is tragic that people feel that they have to hide this.
Yes.
At least somebody who is in the school. There are more suicides among medical students, way beyond what the population norm should be. And tremendously stressful, difficult job. And these are high functioning people who feel that they have to be perfect. And of course, nobody is perfect. But so we spent a lot of time in medical school in the last 20 years trying to make it a safe environment where people can get help, where people don't have to hide their weaknesses, their troubles, their disappointments, their depression. I hate the idea that somebody should keep that to themselves. You got to be careful. You don't want to tell everybody, but there should be it has to be a mechanism where you can safely get help once you're in school.
And it goes back to Kayla's comment about having a safe space. And I almost feel like this student asked a question that I'm really interested to hear Kayla's response, because the culture of medicine does tend to, create a certain bravado where we try to hide our weaknesses, which is not healthy for us. It's not healthy for our patients, and not healthy for our colleagues. So I'm interested to hear your response to this student's question, Kayla.
So what is the specific question?
Let me see if I can
tell
find.
them you're applying to medical school that you're seeing a therapist.
And and then there's the applying to medical school, the culture of medicine being discussed, pretending to have everything under control. Do you think that there's something that needs to change, and should we be encouraging our physicians and future physicians to seek help? And how much transparency should medical students and prospective medical students have about some of their struggles?
Well, there are a lot of ways I could respond to this. One thing that's interesting is that in psychiatry residency programs, it's actually becoming a value to explicitly try to recruit people to be residents who have had lived experience with psychiatric issues. So in that context, I think there's actually been a real movement to say, this is actually a real asset to our program to have people who have really struggled with mental health. And I think, I actually, in my professional life, when I work with students at UCSB, and I've had students who I am seeing for mental health reasons as their psychiatrist, I've talked to people about this dilemma of like how much to share, how much not to share. And I think it really depends on the situation, and it depends on the person, because the reality is there still is a lot of stigma. So we can't, I don't want to be, when I'm talking to a student about their decision about whether to talk about this openly, it's something that I really talk to them about in depth, because, we can't just ignore the fact that there are people who could read it, who could respond in a way that reflects stigma. And I don't want them to be, to suffer because of that. So I really think it can be a tough question, but I think that in general, I would say I would encourage it. I think that writing something that's like thoughtful about yourself and the way that you've responded to things is a really great way to demonstrate one's character. But I would say that as like a general comment, with the caveat that there's still a lot of stigma, and I don't want people to suffer because of that.
And Kayla, I know that you're also a mom, and I know that I see you looking over your shoulder. So if you need to like dial down the physician, educator, role model, hero, and go like take care of a little person, that in the time of COVID, we're all learning how to juggle. I want to read this next question because I think it's a good one. And it deals with the discussion of heroes, being heroic versus being honorable, and also systems in place. And an anonymous student asked this question, and he or she said, "I'm not a healthcare worker, but I feel like it has been a bit exploitive to have healthcare workers working long hours with COVID-19 patients while only praising them or calling them heroes. Do you believe that it would be better if frontline health workers got some hazard pay instead of just being applauded as heroes, or should they just be expected to do this work?"
I personally don't think that healthcare workers are abused. Well, it depends upon who you're talking about. Clerks and licensed practical nurses, don't get paid very much, and there are people in the health system who work really hard and are exposed to danger, who get very little in response, either in terms of thanks, gratitude, praise, or money. So that's a different thing. When you're talking about doctors, I believe this is something that we do, and I'm not terribly worried about needing to get extra credit for it, particularly doctors who are making a very good living. We live in the most unequal society of advanced nations in the history of the world. The richest country, but we also have the greatest child poverty and problems of inequality. Physicians are not suffering. Yeah, they don't make as much as businessmen. The problem there is not that the physicians are making too little. It's that the Fortune 500 is making too much. So I don't think we need to pay doctors to do what they're supposed to do. Residents work endless hours anyway. We've worked really hard to make it not as terrible as it used to be when it was really crazy. But when there's a crisis, you respond to it. That's what we're supposed to do. I don't think you need special credit for that. We do need, way better than we have, support. We need good PPE, which is not there. We need systems in place. We need advice about what to do. It's not fair to take a resident and give them a dying patient and with no support, which is what happened at the beginning of this crisis widely in New York. So there are many things that we've done wrong. Of course, we need to have testing. We need to have all these other things that we as a community have completely failed on, which is why we have such terrible results compared to the rest of the Western world. But we don't need to praise the doctors more. We need to support them more.
Jerry, I want to get into the weeds a little bit on that, because you're right. We've already had this discussion that the healthcare professionals, the doctors, and the nurses too, for that matter, that's what we signed up for. The people that get ignored really do deserve hazardous duty pay and praise. The guy cleaning the floor, the woman answering the phone, the medical records, the people cooking the meals, the people running the sterilizers. This is not what they signed up for. This is their job. It's not a career, it's a job. And this is not what they signed up for. And those are the people that we're blind to them. They're totally ignored. And those are the real heroes.
And they should have the chance to go to opt out if they need. But also, if they're going to work, which many of them want to do because they want to participate, they should get protected in ways that we have been woefully inadequate in doing.
They're taken for granted.
But it also goes back to the comment you made, Jerry, about helping people find their best self. And a lot of people in a variety of different professions, not just physicians and nurses, but, grocery store, people who work at the grocery stores, people that deliver food, farmers, like these are essential workers, and they want to be part of the solution. There's a certain joy and a certain pride in that.
You look at the world and our history. You don't have to look at World War II, any fascistic society. There are people, there are journalists getting killed around the world who are insisting to go out and do their job and keep writing things about the dictator, tyrant who runs their country, and at the risk of their life. People want, there's a thread of humanity that cares very much about doing the right thing. Not all of us will do the same. Not all of us are capable of that level of heroism. But I think most of us have an inclination to participate when we see trouble. And so, yeah, you're right. They're doing heroic things above and beyond what they get credit for and above and beyond what they get paid for. And yeah, Charlie's right. They're the ones who are heroic.
Agreed.
Let me tell you something else. If you think you're going into medicine to get gold stars, think again. That's not what this is all about. This isn't about accumulating merit badges or gold stars. That's not what this is a service industry.
And
you're going into medicine to be of service, period.
But at the same time, you get tremendous amount of support. It's wonderful. You get wonderful feedback. People are grateful to you all the time. And it's lovely, but that's not why you should be doing it.
I want to hear Kayla's response, and I have another student question.
I think that I'm echoing what the rest of you have already said, but this conversation reminds me a little bit of a patient that I had years ago who asked me, why do you do this? Like, why do you want to listen to me talk about these very dark things? Like, why are you subjecting yourself to this? And it was hard for me to exactly articulate this, but what I eventually did articulate is that I really genuinely found that the listening to this patient to be a true privilege. And the privilege, it gives me a sense of satisfaction, and a sense of, I don't know if joy is the right word, but it is a certain sense of joy to be able to connect with someone in that way. And that's one thing that I would emphasize to people who are thinking about what their career choices is. Whatever you choose, there's a lot of ways to help people. There's a lot of ways to help the world. There's a lot of ways to make your life meaningful. But the one that you should choose should be the one that you think will feel like a privilege to you, and that will feel like not every day is going to feel like a joyous wonder, but that in general, when you are told that you have to, work 12 hours listening to people tell you about these things, or standing up and doing this type of surgery, when at the end of the day, you actually feel like I can look forward to doing that. That is the direction that you should choose. You don't have to become a doctor. You could become a journalist. You could become a chef, or whatever it is that whatever you're doing should give you a sense of joy and should feel like a privilege to you.
You won't be good at it if you don't love it.
Yeah.
I wanted to tell you something. One of the most electric experiences that I have as a pediatric surgeon is when parents put their baby in my arms and trust me to do whatever needs to be done. And that's a unique experience. It's hard to describe, but that's sort of my reward. It's intimidating as hell. But I think that's part of what you're talking. When your patient shares their darkest moments with you, that's an incredible validation of you as a healer. That trust, that therapeutic alliance, if you will, can be established. And it's very similar to when parents will put their baby in my arms and say, go fix this.
It's an electric experience.
I want to ask the students question because I think it's very, very poignant, and it comes immediately after hearing Jerry's discussion about disparities and Kayla's discussion about privilege and purpose. And Bongi asked, with COVID-19 highlighting the significant health disparities in the U.S. healthcare system, what do you think are the steps that physicians need to start taking to actively combat these issues?
So I've been actually part of a group that's been writing about this. I think you should think of it in different ways. You can do things on an individual level. You can do things as part of your group. You can do things as part of your community, and you can do things as part of the larger community, the nation. Some of those have to do with advocacy. Some of those have to do with community building. So for example, in medicine, some have to do with your own personal behavior. In medicine, for example, we need to confront racism much better than we ever have. And how do you do that? Well, first of all, you don't hide when somebody evinces some racist behavior, when somebody makes a racist joke, when somebody says, I'm not going to allow that person to see me because it's a woman or because it's a black person, or etc. You don't just stand there and sort of say nothing. You support your colleague, and you create a culture which says we don't tolerate this type of behavior. But it's more than just those behaviors. In medicine, we're filled with a litany of unequal treatments in medicine. We're filled with a litany of people don't get promoted equally, or they don't get hired equally. You work on those. You work within your group. You advocate on a larger basis. We have medical societies that have some power and usually have a lot of money and do a lot of activism, but they're mostly about making more dollars for their members. It's not about making. They all say we're all about the public health, but mostly they're not. How about getting a medical society to demand universal health care, or to demand changes in the way in which we systemic racism in medicine. There are lots of things that we can try to do as a group that you can't do as individuals. So it's multifaceted, but the one thing you can't do is nothing.
I would add to that and say that part of dealing with this, first of all, is understanding the how before you understanding the why it is this way, before we can talk about how to solve it. And so, study history, read everything you can, learn about how this came to pass, not just take somebody's word for it. The other thing I wanted to add to what Jerry was saying is when you observe a racist comment or an inappropriate comment or wrong behavior, shaming that person is counterproductive. This cancel culture, shaming somebody, is counterproductive. When this stuff happens, these are teachable moments, not opportunities to shame somebody. It's a chance to educate and teach, not ostracize and shame. So take advantage of these. When you observe these, you don't do it publicly, step aside, have a quiet conversation. This is how your behavior affects me.
I agree completely, but I also think that the culture in our larger culture is to ignore and to pretend. We hear over on the television all the time, it's not enough to be non-racist, you have to be anti-racist. You think you're being non-racist if you yourself don't make racist remarks. But
that's not enough.
If you tolerate a culture and it's not just remarks. Remarks is the least little bit of it. It's where there's systemic racism all around us. And medicine, I promise you, I could give you many, many examples of horrendous behavior on a systemic level. If we just tolerate it, that's.
But what we're talking about character.
Comment about what Charlie said. There is this notion out there in the world of politically correct, which says. Which claims to be about, I want to have the freedom to speak my mind, and you won't let me by being politically correct. You said, you make this, you say, no, you're being racist, and you're just being politically correct, and you won't let me speak, and you're violating free speech. I think it's exactly the opposite. What somebody who calls you politically correct is actually doing is saying, I don't want you to speak. I don't want to hear what you're saying. I want to be able to speak. I don't want to hear what you're saying. I'm all for free speech. You can say whatever you want. You can say as racist a thing as you want, but I should have the right to say I object. That's really, really important. We have the right to hold people accountable for what they say and do.
And I want to just make the comment for the students that what we're talking about is character. Standing up to injustice is character. And the way people go, the different styles of standing up to injustice, there's a lot of different ways to do it. And there's no one right or wrong way. But what you're talking about is character. And these are, and you know, I respectfully disagree with you, Jerry. I think character and virtues can be taught, but we can have that discussion another time. I'm interested to hear Kayla's answer to this.
At 3-year-olds, they can be taught, but I'm not sure at 20.
I don't know. My 3-year-old is he's pretty tough on us. So.
He's virtuous. I've met your 3-year-old. He's virtuous.
Kayla, how can students become advocates?
I mean, I think that I agree with most of what's been said. I think that it starts with listening. Like one thing that comes to mind, a small anecdote is like in my cohort in residency of a group of 16 or 15 people, there was one Black woman who was a pretty good friend of mine. But it was only at the end of our residency program, like the 4th year, that she started to talk about the like tremendous discomfort and like painful situations she had been in many times throughout the residency, and the way that she felt in the program and in various contexts. And to be honest, it was a very big surprise to me, like to hear what her experiences were. And it was like a wake up call for me to realize like how clueless I was about it. So I reflect upon that with a lot of the like recent discussions, just to be aware of one's potential cluelessness and to really be listening and asking questions to try to understand from people who are experiencing it, what is the situation for them and what from their perspective would be a way to make it better.
And the reason we fail to do these things that are necessary is because they're uncomfortable, they're hard. So it's not like you're bad, you don't want to support your colleague when they've been abused in some way, but it's really uncomfortable. You don't know what to say, you don't want to screw something up. We have to have a little more courage, and as you said, we have to go out and seek to learn things, not just to expect it to be brought to us.
Which is curiosity.
What's that?
You're right. It takes courage to deal with these things.
Yes.
It takes courage. It's a lot easier to take out an appendix than deal with how your fellow resident felt, Kayla.
I'm going to summarize a few students I want to summarize and kind of rephrase a question. There's a lot of students who are asking about trust and how right now there's such polarizing beliefs and such skepticism, and because of these systemic themes in our healthcare system, now physicians, public health experts are getting out and saying, we want you to wear masks, we want you to physically distance, we want you to keep your hands clean, and people don't trust us. And how can we, because I think this is a character question, how do we, as a community, as a collective, because there has been this discussion of individual and village, how do we as the village of the stewards of our healthcare system re-earn the trust of the American people that we care about their health and we want them to be healthier?
I don't know that that's a fair characterization. We're in a crazy place in the world right now, and we have a crazy internet where there's all sorts of conspiracy stuff, and it can be hard to know what's true because there are so many people saying different things are true. The world actually is flat. It's all a lie, and it's a conspiracy that it's round. It's really not, and et cetera, et cetera. I don't know that you can fix all of that all at once. I think you can't, the way you build trust in the most part, I think a lot of people right now at this particular moment very much trust physicians. We are, inappropriately or not, we are being considered heroes right now. Look at how great they are and what they're doing. And so I think a lot of people, this is a great time so that your public words will have impact. but they won't have impact for everybody. How you build trust in an individual one-to-one thing, that's a whole different thing. And that's probably where it's most easy to do and most successful. But I do think we have an obligation at this moment in time to be a voice, not to be silent, even though it won't be universally understood.
Right.
Yeah.
Well, I recognize what you're saying, Jerry, that there are a lot of major frustrations in terms of feeling like one can get a message across when there's constant propaganda and social media conspiracies. One thing that I would say on the more optimistic note of like, what's a way to try to build trust and to connect with people. Well, one person that I look to is the Prime Minister of New Zealand, Jacinda Ardern, who I think is a great leader and talks a lot about leading through empathy. So one way that I try to do that, and this is a way that I also really try to use, something that I try to do to gain the trust of, I work with a lot of patients who really don't trust psychiatrists. And in fact, like the main issue that they're coming about is paranoia. So it's a big roadblock. So one of the things that I try to do is I try to first validate their experience and to show them that I hear what they are saying and that I care about what they're saying. So what that could look like in a conversation about masks or whatever it might be is to say something like, I hear that you're telling me that you think that masks are going to limit your ability to be free. I hear, like, to reflect first, to demonstrate that you actually hear them and that you're listening to them and that you care about their emotional experience of what they're describing. And then after I try to demonstrate that I've heard them, then I will often say, would it be okay with you if I shared some of my thoughts about what you're saying, or some of my concerns or my worries about what you're saying? And then usually, this is like a motivational interviewing technique too. And then they might say yes, usually. And then I share that I'm concerned that the data that's coming out on masks suggests that it's actually really important in terms of limiting disease spread. And this is what it says, and trying to like tone down my affect as well, to avoid what becomes a tug of war. So that's my general advice in terms of trying trust building and conversation.
And that's very consistent with what Charlie said about not shaming people, but actually trying to teach them. And I think that's great. That works very, very well. In fact, it's critical on one-to-one things. I think that's a lot harder if you're talking about talking to the community. And when you cite the leader of New Zealand, that's a little unfair because she lives in a rational community where they actually have a sense of community and where they do trust her and they trust each other much more, and they're engaged in trying to take care of each other. And it's not to say there's no thread of that in our country. There's a huge thread of that. There's a lot of interest in doing the right thing and helping each other, etc. But we also have craziness, and so I think it's a much harder hill to climb to get trust in a public forum.
I would add that one of the, it's not a burden, but one of the responsibilities that comes with being a healer of any kind is that your customers, your patients, nice kid, why aren't you in bed yet? Clean up your room, do your homework.
Hey now.
One of the
we're trying to teach virtues here. Come on, Charlie, simmer down.
Yeah, cleaning up your room is a virtue. But one of the responsibilities that comes with being a healer of any kind is that people generally want to trust you. It's not a mystery why more people trust Tony Fauci than our ersatz president, because he's a doctor. He happens to make sense, but people generally want to trust their healthcare professionals. They generally want to.
Comparison, Charlie.
Let me
finish my point though.
All right.
But one of our responsibilities is honoring that trust and making the most of it and respecting it. And I think that's a lot of what you're talking about, Kayla, is honoring that trust, validating people, and using it as a therapeutic tool. But that's a tool that we have that we need to honor, is the trust.
Which I think is
we also have to acknowledge this. You know, we didn't mention, but one of the groups that doesn't trust physicians the most, there's African Americans, and there's a really good reason they
There's a
don't trust it.
historical
It's that
context to that.
they have been mistreated for a very long time. So one of the things you have to do to get trust is to be trustworthy.
Mm-hmm.
And I think it's a challenge for the students is that, like you said, Jerry, for the students that are listening in to this panel who will go to medical school and will be given the trust of individuals and communities, what do they do with that trust is very much like you said, be trustworthy, and to have different virtues of character guide them in a very just arc. Another student asked a great question, and I think because we're running short on time, I want to make sure we have time to get to this. Dominique asked, how have you effectively stayed in touch with your values of why you pursued a career in healthcare? Have your values changed over the years, and if so, how? Have you effectively stayed in touch? How have you effectively stayed in touch with your values, and how have your values changed?
So
Well, I listen to Mozart on a regular basis.
Yeah, but that's been pretty consistent, unless you
That's how I stay in touch.
hip-hop and you became a Hamilton fan along the way.
I am a Hamilton fan, but I listen to Mozart, and the Bach partitas are very soulful. That that grounds me a whole lot.
I don't think my values have changed. Maybe I hope I've gotten a little more mature and I know how to express my values better. But I consider what I do, what I've done for my career, a tremendous privilege. It's incredibly rewarding all the time to be able to take care of people, and then you get their gratitude as well. That grounds you. It grounds you when you interact with human beings and you listen to them and you care for them. And so the job itself, if you let it, if you value the things that you got into this for, you wanted to help people, you wanted to make them less anxious, less worried, less sick. If you really value that, you get the chance to do that all the time. Boy, that's tremendously positively reinforcing. I think for practicing medicine, caring about your patients reinforces the best of who you are. I also think teaching is a great way to reinforce your values. I was lucky enough to be a teacher for most of my career.
Yeah, I'm glad you said that, Jerry, because one of the things that I get out of sessions like this, out of Jason's course, and out of the stuff I do in the ethics program is a chance to be around undergraduates, and it's refreshing. It reminds me of what this is all about. And hearing how the undergraduates speak with such intelligence and informed views is so refreshing, and that grounds me a whole lot. Keeps me from being overly cynical.
How about you, Kayla? How do you stay in touch with your values, and how have they changed over the years?
I also wouldn't say that I feel that my values have really changed that much, but I would say teaching is one way. My patients is probably the main way. Talking to my patients, and my patients definitely always ground me and challenge me. Continuing to very frequently collaborate with colleagues, and then a little bit of an echo of what Charlie was saying, art. So for me, I love music, but I would say the primary one for me is definitely literature, primarily novels. So reading novels, like whenever I feel burned out, I know that I need to really find something good to read, and that will usually recenter me quite quickly. And poetry.
Try Mozart.
I appreciate that as well, yeah. I do want to say that I am going to have to leave in a couple of minutes to put this baby to bed. So I do want to just
any parting advice for our students, and I think also because we've talked about disparities, advice for our students for who are women and want to be successful leaders in healthcare as well as be excellent moms.
Well, I am definitely biased in favor of women leaders, as I mentioned, Jacinda Ardern. I think women, not to be overly gendered, because I think men obviously could have this as well, but there are certain quote unquote female characteristics that in our culture have been denigrated. And I think they're actually qualities that can make for the most amazing leaders and the most amazing doctors. And actually some of the qualities that are considered more female, so to speak, are things that like if you think about developing them further, could actually really change the face of our like political system and healthcare system if we actually valued them and dove into those. In terms of like being a physician and mom, I think they both really help build the, like you can become a better mom when you're a physician, and you can become a much better physician when you're a mom. And I would say that it definitely is possible, though it can be challenging at times to have some kind of balance, which is, as you can see, I'm leaving this panel maybe a little bit early to put this baby to bed. But it is definitely possible to do that and to like be centered on your values and what you want to be able to do what you would like to do.
Kayla, you're a warrior poet. We'll let you go, and please, my kind regards to the family. And we're going to hear from you again on this summer series talking about mental health in pandemic.
Yes,
So,
thank you very much. Thank you for having me.
How about you, Charlie, Jerry? Any advice for students? I know there's a lot of excellent questions here in the chat box that we just didn't have the time to get to. But advice to students who are interested in careers in medicine and in healthcare.
I was noticing that one of the questions about, if I remember, if I could paraphrase it, is medicine an appropriate career if I'm an anxious, stressed person? And I don't know how to answer that, because medicine, being a physician, is anxiety provoking and it is stressful. And I think, you know, somebody like Kayla can help you manage that stress. But there's no question what being a healthcare professional is stressful, because the accountability level is different from any other career. It's totally different. The accountability is totally different. And that can be stressful, and how you manage that is really important. And I certainly had no training in it. I just listened to Mozart. That's how I manage it.
Well, you know, I've always said that the most important thing you should do in a code, in a trauma, in some big event, the first thing you should do is take your own pulse. And I don't really mean that. I really mean is that the most important thing is to be calm. And so if you cannot, you know, we all can get anxious under different circumstances. If you're not able to control your anxiety in moments of great stress, there's probably, at least what I do, is probably not the ideal thing for you. Medicine can be very, very, very stressful. My advice to everybody has nothing to do with medicine. It's to find what gives you satisfaction, what makes you feel like you're doing something of worth. And that, you know, I could have been a musician, and I could have been a director of plays, or there are a lot of things I could have done and enjoyed. And I think if I had done them, I probably would have loved them like I love medicine. But I do love what I've done. And that's helped me to do it for a long time. If you don't love what you're doing, you know, you're going to spend more of your life working than any other single activity except for sleeping. If you think about
not even that, it'll be more than
Surgeon's going to chime in on that one.
But you know, if you're doing this so that you can make a lot of money and retire, this is crazy. You're throwing your life away. You should do whatever it is that when you get up in the morning, you want to go to work. And that doesn't mean that every day you'll feel that way, because there'll be days when you're really exhausted or whatever. But it should be something that brings you satisfaction and joy. The hidden benefit is that that's how you get good at something, is when you love it. So that's my advice, is don't do this for any reason, because it's prestigious or it's well paid or because somebody expects it of you or you expect it of yourself. Do it because you say to yourself, I want to be that person, and that the value that you ascribe to this can be different for each of us. It can be, I want to be a scientist. It could be, I want to be a researcher. It could be, I want to be a teacher. It could be, I want to be a healer. But whatever it is, it better be something that you love.
And I want to take,
go ahead
real quick. I just want to take what Charlie and Jerry, what you said, and give a shout out for those who are going to stick with us for this summer seminar series. In 2 weeks, on the 18th of August, we're going to have a group of, we have 2 ICU docs, an anesthesiologist, and an infectious disease doc. And we're going to talk about allocation of scarce resources in our local community. And as the person that chaired the committee at our local hospital to come up with an allocation strategy for if we run out of ventilators, I learned to develop an appreciation of the character and the quirks of my colleagues, and how, you know, and it'll get back to how straight, like the ICU doctors were very hung up on the little small, tiny little details. And the palliative care doctors were very keen on making the experience well communicated. And me as an emergency physician, I was like, okay, make decision next. And we all approached these problems with very different perspectives. And what our community needed was all of those perspectives sitting around the table. And there was a tremendous humility and a tremendous mutual respect that in 2 weeks, if you listen in, you're going to hear that mutual respect, because, you know, part of this whole process of, you know, applying to medical school, going to medical school, succeeding in a career in medicine is recognizing what your strengths are, what your weaknesses are, that self-awareness that Kayla added to, but also making sure that whatever you do, you stay anchored and grounded in principles of character, of empathy, humility, justice, integrity, honesty, that you always strive to find the best version of yourself, even under the most adverse circumstances. And you, sometimes you succeed, sometimes you fail forward, but you still, you always make sure that those principles are the guiding compass. So that's my shameless plug for 2 weeks from now. And we're very short on time. There's a lot of excellent questions here we didn't get a chance to. I think a lot of the questions about race disparities, we're going to have a discussion focused just on that, and COVID and inequities to race. Any other kind of final comments, Charlie, Jerry?
No.
We've covered a lot.
Is it?
Yeah, this has been
this is an endless topic. We could talk
Yeah.
for many hours, and but you know, I think we've enough for right now. Unless you
I'd
have
like to get some
question.
feedback from our students about what this looks like on their side.
Yeah, so students, please give us your feedback. We're trying to keep the medical humanities discussion going. And for all of you out there who are in the front lines as an essential participant in our community response to making a healthier community, thank you for what you do. What you do is honorable, and you have my respect and my praise. Charlie, Jerry, and Kayla, your constant advocacy for students is always your role models for me. So thank you, and hang in there, everyone. Stay safe out there. Wear a mask. Keep your hands clean.
Take care of each other.
Take care of each other, always.
Thank you, Jason.
And thank you. And I think at that, Jack, let's go ahead and end the webinar. We'll make the recording available for people to watch. And you know, encourage. This is a free resource to the student community. So we hope that you'll dial in every 2 weeks, listen in, and give us your feedback and your questions.